Hello, my name is Sheila, and I'm going to present the natural history of pertussis, also known as whooping cough. The point of this is to understand the stages of a disease so that we can target treatments and interventions at each stage of the disease to either prevent it from infecting someone or decreasing the severity of the symptoms in someone who is already infected and essentially improve population health and outcomes. Whooping cough is caused by a bacteria called Bordetella pertussis, which attaches to the cilia in the upper respiratory tract and releases toxins that cause damage and inflammation. Interestingly enough, pertussis is only spread through humans, and the bacteria lives in the mouth, nose, and throat, and is spread through droplets when a person coughs or sneezes, and then another person inhales it, essentially. The next slide will focus on the symptoms and progression of the disease. So here's kind of a timeline of whooping cough. It starts in the pre-symptomatic stage where you're considered contagious after exposure, and that can last from anywhere from 5 to 25 days of no symptoms but being contagious. Once you start to develop symptoms, it'll be general cold symptoms, runny nose, sneezing, mild cough, low-grade fever. It's not until the later symptomatic stage where the coughing becomes severe and rapid and starts to get that high-pitched whooping sound from inhaling after you cough. And the first 2 weeks, these cough attacks will slowly increase and then occur more frequently at night. And then they'll kind of peak after 2 to 3 weeks, and then the coughing attacks will slowly decline, although you can have coughing that lasts up to 3 months. And it's not going to be alleviated with cough medicine or cough syrup. The treatment would be antibiotics for it. And so once you hit the final stage, you either recover, the disease runs its course, you get antibiotics, or you die. So that is with all diseases. We can look at collected data on whooping cough to see what populations are most affected and who's at highest risk. So if we look at these cases by age group, we can see that 25% of cases are from children less than a year old. The other 25%, adults greater than 20. But 50% is children and adolescents somewhere between ages 1 and 20. So we know that whooping cough affects children more than adults. We can see from data collection in 2023 and 2024, for some reason, there's a 6-fold increase in the cases. So Illinois had about 2,300 cases, which was the third highest state behind Wisconsin with 2,600 cases and Pennsylvania with about 2,900 cases. And so we can also look at the mortality, and we know that most of it's just infections that resolve. Only 10 kids died. 6 of them were less than a year old, 4 of them were greater than a year old. Still not great because the disease is preventable, so the goal is obviously 0. But we can use this data, and then we can look at what interventions are in place at the local health departments, compare them by state if we want to see, is it because states are doing things differently at the health departments? How is tracking being done? And we can just get more information. The goal, again, is to decrease the amount of people infected with whooping cough and to prevent it. And so the next slide, we'll look at some of the risk factors as well. So our high-risk populations, if you can imagine, would be children less than a year old. We looked at some of that data. They make up a good chunk of reported cases, and also we know children have immune systems that are not fully developed. Also, on the same token, then, immunocompromised patients, their immune system's not up to par. And lastly, those with reactive airway disease like asthma. You have this airway that is already reactive to whatever triggers it, and then you put in this bacteria that causes inflammation through toxins. And so these populations would be our target populations. We want to ensure really don't get whooping cough because they could have the more serious complications of seizures, death. Although, it doesn't always end in death. Less serious complications would just be dehydration, loss of appetite, ear infections. Having said that, all age groups are at risk for contracting pertussis. And so this will lead us into our treatment and prevention plan on the next slide. So this brings us to our treatment and public health implications. So the most effective way to protect against whooping cough would be to get vaccinated. Great news, anyone and everyone can and should get vaccinated. You start with the DTaP, and then later you'll get the Tdap. And essentially these are just combination vaccines, and it stands for tetanus, diphtheria, and pertussis. So if you follow the schedule, at 2 months, 4 months, and 6 months, you'll get it. At 15 months, you'll get it again. Somewhere between 4 to 6 years old, you'll get it for the 5th time. You'll get a booster, which would be the Tdap, at somewhere between 11 to 12 years old. You get pregnant, you get the Tdap. You've never had it, you can get the Tdap. Where is it available? Anywhere you want it. Family practice, public health department, community health clinic. You can't afford it for your kid? They have Vaccines for Children program that's available, and it's financial aid so that you can keep your loved ones safe and healthy. What else can we do besides get vaccinated? Good hygiene. Wash your hands, cover your cough. If you're sick, isolate. Don't go around babies. Don't kiss them. Don't be out in the grocery store. Things that you should do anytime you're sick, really. So otherwise, yeah, get vaccinated. Early detection, not really good. You'll start to get symptomatic. You'll get that little scary coughing, and then you'll go to the doctor. They can swab your throat or do a blood test. You pop up positive for whooping cough, then they'll throw you a macrolide antibiotic, azithromycin and erythromycin, and then you'll get better. And that's the progression of the disease. So, what are the implications of knowing this information? Well, we've looked at how the disease infects humans, the progression, the symptoms, the treatment, and prevention. We've looked at the data, we looked at high-risk populations, and so what does all this mean essentially? Because we have this data, and because we know this information, then we can tailor the interventions. The public health departments can have vaccines available, we have programs available, we are tracking the data, we can understand why are there fluctuations from year to year, why are certain states at higher risk. We can look into all of these things and then decrease transmission rates, which is our ultimate goal. We made it through the presentation. Here's a list of my references. Thank you for listening. Have a great day.